Let's talk about ambulatory surgery outside of the hospital. What do you see as practical challenges for that kind of surgery? Dr. Prokopakis.
You're talking about private office? I have seen twice in my practice generalized shock, allergic shock to xylocaine. I've seen it twice. And the strange thing is that I saw it in an interval of 6 months, 15 years ago, but I've seen it. And it was a terrible experience. So for this kind of operations, my personal belief is that I do not agree to perform this kind of operations in a non-safe setting, and I consider the private office as a non-safe setting unless the private office is based in a clinic or in a hospital. This is different.
Dr. Rombo?
I'm working in a university hospital. I do not have any experience about ambulatory surgery outside my hospital, so I cannot answer to this question.
Sorry for adding something, sorry. But I've got a colleague in Crete who is working in his private office in a small town in Crete. And very recently, he was offering for six treatments of laser treatments for polyps in the nose in his office. So there were patients that they were going to this physician, having 6 series of treatment for nasal polyps with I don't know what kind of laser. So I don't think that doing all these kind of procedures in an office with no criteria, with no, it is safe.
Dr. Hopkins?
I think a lot of this work was driven by the environment in the States, where they have a division between hospital practices and private office practices. And this opened the door to a lot of surgeons that only had access to private offices to perform a lot of rhinological procedures. So the market has grown very quickly. And I think the risk is there, provided they meet the basic demands of safety and resuscitation and everything else, that's okay. But they allowed the setting to dictate the treatment that the patient got. So instead of taking the patient and assessing what was best for that patient, they said, well, I'm in an office, you will get office-based surgery regardless on the extent of disease. And I think it is all about patient selection. I think an appropriately limited procedure under local in an office for the right patient is an excellent procedure. But I think committing a patient to a local anaesthetic procedure in office because that's all you have access to, or that's the most sort of best remunerated procedure for you, is absolutely the wrong approach. And we have to be careful we don't go down that route.
Mm-hmm. Dr. Carrie, do you see other challenges?
I think the discussion has been really interesting. For me, one of the strengths of something like this is being able to set up a system that almost works in parallel with what's happening in the operating theatre, but never to separate them completely. And it goes back to what Jannis was talking about in safety. I think universally one thing we have all agreed about is that this has to be done in an environment which is safe, so with access to the appropriate facilities and skills.